I'm Jenny Gablesberg. I am the owner and founder of Women's Advantage Men's Optimal Health Physical Therapy, affectionately known as WAMOH, PTOT now. So we tend to be very academic focused. It's one of the things we feel very strongly about. One of our core values is relentless curiosity. So we're starting with clinicians that are really hungry for mentorship and hungry for knowledge in general. So we designed WAMOH University. So it's an internal mentorship program where our new clinicians, where they're getting weekly mentorship for the entire year. I look at these and think it took me 10 years to get to where our clinicians now are getting after 1 year. We also do have a 12-month pelvic health accredited residency.
I started doing the research, and when I was doing the research, I was like, wait, NICU babies, they're actually pretty well supported. You know who's being left out of the equation is the moms. And I was like, that's the population. Like, we're not seeing the moms. I ended up getting to work with this amazing maternal health occupational therapist, and we created a 4-week program, and it was infant massage, sensory processing, physical recovery, and routine building occupational balance.
Professionally, I was working with these people in the hospital that were getting these chronic UTIs, that were making their hospital stays longer. And I just kind of started drawing the line, like, if they were to have gotten this care younger, would they have not had all these health impairments later in life? Would they be more autonomous and healthy with their pelvic floor to not have all these other secondary issues that's keeping them in a hospital, reducing their quality of life? So I want to help people now. So in 20 and 30 and 40 years, maybe we're seeing less of these hospital stays, less of these people having to deal with these health conditions that could have been prevented years ago.
When I was a therapist, that was such a joy to me, being able to hear all the patients' stories. And they'll say, thank you so much for having a place like this. Like, we didn't know places like this existed, and you have helped me so much. So that's lovely to get to kind of hear those, that kind of feedback from our patients.
And we're really trying to bridge that gap that's happening in the maternal health care system right now, where we're seeing so many preventable issues happening for the women in our country after they've given birth, and so much that's being missed, and such a lack of support that's happening in the postpartum period. We're just being told everything's normal unless there's an emergency, but a lot of times people don't know what's normal, and they're left to go home and they feel really uneducated and under-resourced. And so we're really trying to bridge that gap so that they're getting that in-person contact that they need, so that we can help to catch some things earlier to help prevent readmission and give them strategies, as well as giving them just the overall support that you need as a new parent, and resourcing them to not just what pelvic health can provide, but also what is available in our community, and helping them to get plugged into that so that they feel really resourced in the postpartum period.